Good.
Sabi is a spotted hyena and he's been with us from a young age. He is a very excitable, lovely creature, but he has certainly had some medical issues historically. So he presented late one night with a really bloated abdomen and he appeared quite painful. So he was quite hunched and not interacting with his keepers as we would normally expect. We were performing ongoing testing, but we'd got to the point where we really needed to do some advanced imaging. So we spoke to our colleagues at Animalius and organised a CT scan of his abdomen and spine.
This was weeks in the making, so there's lots and lots of planning that goes into procedures like this. Obviously it's a really big deal taking one of these animals off site. There's so many things to consider, lots of gear to pack, lots of drug calculations to do, lots of things to order just to make sure that everything runs as smoothly as possible on the day.
So we needed to anaesthetise him first at Perth Zoo and then transport him anaesthetised to our colleagues at Animalius. So given Sabi is classified as a dangerous animal, hyenas actually have one of the strongest jaw strengths known. So we will always have one vet and one nurse who are primarily just ensuring that he stays asleep and he's safe when he's asleep. So we're monitoring as you would for any other cat, dog or any human really.
Yeah, there's always so many things going through your mind, but predominantly all I'm ever really focusing on is him. I want to make sure that he's okay, that everyone else is safe. Hooking up to a patient monitor which monitors his heart rate, his blood pressure, his temperature, and it's also got a capnograph which measures the qualities of his breath.
Another breath is, yeah.
We performed a CT scan of his spine and his abdomen, pretty much a whole CAT scan effectively. Then we also did some upper and lower endoscopy just to make sure there was nothing else concurrently occurring in his gastrointestinal tract or his gut. That all looked pretty normal. We also took some biopsies for some, just to make sure there was nothing else going on that we couldn't see with our eyes. And they've all come back negative, which is great news for him. However, the results of the CT scan did show that he has most likely a condition called discospondylitis, which is where you have an infection of the intervertebral discs and the adjacent vertebrae. He also has a spondylosis, which is a degenerative condition of the spine. So it was really important that we actually did that further imaging because it now allowed us to get those really fantastic images of his spine and his disc spaces to make that diagnosis. We also have the luxury of speaking to our surgical, medical and imaging colleagues out at Animalius as well, who all have specialised expertise in these areas. So it's a really collaborative case.
It was a big day. It was a big day and it was a very long anaesthesia, but he did spectacularly and he woke up nice and smoothly, which is also really great, and he was back up in his enclosure by the end of the day.
So at 18, he certainly is getting on in age. However, the finding of the discospondylitis does warrant quite tailored therapy, and that's where it gets quite tricky when you start dealing with something like a hyena. As compared to our dogs and cats, he is at this point in time pain-free, and he's a very good patient because he loves to eat, which means we can get all his medications into him. So he will quite readily take everything that's offered orally, which is certainly very, very helpful for us. We always go above and beyond for all of our animals here at Perth Zoo and really proud to be part of that.